This is Healthcare Uprising. We are here to shine a light on the innovators implementing positive change in American healthcare and the patient experience stories, good and bad, that can help others navigate the sometimes overwhelmingly complex American healthcare system. Welcome to the Uprising. We are not doctors and we don't play one on TV. If you need medical advice, consult with your physician or a healthcare professional. The whole neural networking thing is fascinates me.
It is.
Like,
Yeah.
our brain is so complex. I've been under the impression that the whole quantum computing thing is going to be necessary to really properly build like a human level neural network. Is that correct according to your knowledge?
Yes. So if we really want to get close to human brain, the way that they function and filter and learn and relearn, it's very complicated and requires a lot of computational resources if we want to like exactly implement that. So the bottlenecks are the hardware side running the hardware that can excel at that level, and not only the speed but also the efficiency, and the quantum physics really helps on that side.
Right.
So you go to your provider, the visits don't last that long. It's 10, 15, at most like 20 minutes. There is no way your provider get a better understanding, a deep understanding on who you are, where you are standing in the spectrum, and how he or she can provide you a personalized care. But with the AI, we can ingest all of that information. All of us have so many wearables, have phone, have access. We are logging lots of information directly or indirectly, which we can be ingested with AI. We can analyze it, provide a very good summaries that's easy to read and understand from the healthcare perspective, and help them to have a 360 view of you as a patient or a client, so they can stay connected with you.
Do providers themselves, so I'm thinking like I would enroll in this as a patient, right? But like, let's say, and I'm, here in Arizona and I see, so-and-so Dr.
Mhm.
Carr back here, for my therapist. How would they engage with the platform? Would they need to be like part of a network, or do I just say, hey, I'm journaling, I'm tracking all this stuff in here.
Mhm,
Like,
mhm.
how do they get engaged with the app, or or maybe how do I get my own doctor, kind of, eh, you know, enrolled
Yes.
or engaged with this?
That's a great question. So we start with the doctor. So we are B2B
Oh,
kind of business. We are B2B2C. So we start onboarding all the doctors or providers by building relationships with the organization. So we are starting building relationships with California Psychologists Association. And then through them, and we are building relationships with local communities of therapists, LMFTs, social
mhm.
workers. And through them, we onboard providers, and then through providers, they onboard their patients. Um,
Oh, it's the other
and
way
then that's,
around. Got it.
yes.
Okay, so you're going via the providers and then to the patients. Okay.
One of the bottlenecks of the current healthcare systems and is that a woman um, has not been included in so many of the trials before. And that's why the outcomes of the specific routine or procedure for a woman is so different than men. That was one of the big topics on the JP Morgan Healthcare Conference just the last week, that FDA started to bring more regulations on and standards on how, at which level and which percentage women should be included in the trial. So with the data that we were able to collect and analyze, this will open a very big window and opportunity for all the research-based, companies and institutions to tap on this great data and start creating better healthcare plans and systems specifically for women. And that's one of my dreams that I hope comes true.
Oh, that's great. Take the power back, man. Yeah, I'm all for it.
You're in the
But
right
I really,
place. Yeah.
but I really would like to take a moment and say that it's not just a woman's problem, it's our family problem, because women are at the core of each family, and each of us have a family, right? If the woman in the family, whether this is a mom, this is a daughter, this is a wife, has a health problem that impacts all of us as a family at some level. And I think that one of the key things that we should all focus on it, if we want to make any improvement, is to change that mindset. And it starts with all of us as an individual to talk about it at the dinner table, that what do we think about it, and there is a bias, obviously, that started, I don't know when, but if you want to change the bias, the only way is to, like, culturally doing more advertising about it, talking more about it, helping in any way we can. If we are thinking about investment, invest on that. And it doesn't have to be big. We can start small, just promoting and helping people who start this movement, because at the end of the day, it's going to impact the whole family and all of us, no matter where we are. And I think it's really a cultural mindset that needs to be shifted. Startup community, we're called Pre-Seed. We have a working prototype as a web app, which you can also install it in your phone as a mobile app. So we started with mental health, as I said before. So if you're in mental health, you are more than welcome to give it a try. You can go to apps.cybelehealth.com and register as a provider. We will verify your credential and approve your membership. It's totally free. Then you can start onboarding your patients. They will go the same way to the same platform, but register as a member. It's also free for them. And you can start as a provider, you can start by creating educational materials. You can decide whether you want to serve it as a free or as a paid. Your patients or everybody else in our platform can learn more about your knowledge and expertise about where you want to have to share. If you're on the insurance and brokers or payers, I would love to talk to you. That's one of my focus areas these days. And that was one of the beauty of the JP Morgan conference, that I made so many connections. So on our to-do list, we want to make all the payments that patients have to pay, whether this is a paid course or, the journaling that they have to pay for it. They can get the reimbursement from insurance, either pay it as their FSA or get the reimbursement from insurance. So that's one of my to-do list, top priority.
This has been a Shut Up production.